Hi, I'm Yinka, and this is The Hurt Locker, a podcast where we open a door into men's mental health. Come and go.
1 in 4 black men in their lifetime will get prostate cancer.
What is a prostate?
It's a really, really important question.
How do you get over the challenge, the stigma?
It's so important that we get them to check their risk. It really could save your life.
You're listening to The Hair Locker, the podcast that opens the door on men's mental health. And tonight, we have from Prostate Cancer UK, cancer charity, CEO, Keith Morgan. Keith, welcome to The Hair Locker.
Thank you very much, Yinka. I'm going to have to give you my official title because otherwise my CEO is going to have my is going to have my guts regardless. So it's very kind of you. You've promoted me, but I'm the Associate Director of Black Health Equity at Prostate Cancer UK. So yeah, it's a pleasure to be here. Thank you.
So I was pleasantly surprised when I saw your face. I had seen it before, but when I saw your face then, I thought, yes. So tell me, how long have you been in the role?
I've been here coming on 7 months, but it's truly been a roller coaster. It's felt a lot longer than that. You may notice that I've got a bit of a gruff voice, and it's because I'm recovering. We were at the Mobos, so we were the official charity partner for the Mobos this year. That took place on Tuesday. Obviously, Mobos is a massive, cultural institution. It's done amazing work to really help black artists, especially new black artists, navigate the whole industry, the whole music industry. And we're a charity that helps men, in my role, particularly black men, navigate the whole health system around prostate health. So it was great to be the official charity partner this year for them, and just felt like a natural fit because we're both focused on championing black equity. And so, yeah, we were the official charity partner, and we also sponsored their Best Male Artist category for this year. And it was fantastic. We had one of our, huge ambassadors for us, Tim Campbell from The Apprentice.
Yes.
He presented the award for Best Male Artist, which Central C won. And I think he went a bit off script, which was fantastic for us, but he really pushed the message for us about black men's level of risk of prostate cancer and how important it is to check.
And that's why we've got you on here. Yeah. Tell me, before we go into it, what led you to this role of being Associate Director of Black Health Equity?
It's something that I've been conscious of having an interest in, but I've always also been conscious of the amount of energy, focus, and resilience it takes really to do a good job in those roles, because effectively you're entering into a predominantly white organization and you're saying we need to focus on, a specific group of the population, which is a small, relatively small part of that population. And every day, your work is around changing behaviors, changing mindsets, getting people to understand the really unique barriers that, in this case, black men face in, accessing the right level of support, treatment, and care for prostate health. And so I was a bit, if I'm honest, I was a bit hesitant about taking on an equity role because I know that they can have quite a short lifespan because you get really exhausted and it's quite draining, always trying to push the agenda. But this one just I just got an impression from the way in which they structured the JD and what the ask was in terms of what character they were looking for, that it wasn't performative, that they were really invested in black health equity. And then I looked back at some of the work that they had done, and again, I was just really encouraged. Their investment in black health equity has really evolved over time to a position where they're ready to be a legitimate advocate for black health and for black men. And for me, that was the appeal really, is being assured or being reassured that they're in it for the long game, and they appreciate the impact that having a black man in this role could have in terms of bridging some of those partnerships, advocating on behalf of black men, being seen as a legitimate advocate. And that's why, being the official partner of the Mobos was such an important moment for us, because there is certain, parts of the black communities that we can't reach because we don't have that existing trust and relationship.
Absolutely.
They don't yet see us as an authentic advocate for them. And so that's why it was so important to develop that relationship.
Thank you. Before we continue further, what is a prostate?
What is a prostate? It's a really important question because most men don't really know what a prostate is and what it does. So the prostate is a gland. It's usually the size of a walnut, in the shape of a walnut. And it grows bigger as you get older. So from the age of 50, it can get bigger. And that's normal. It sits underneath the bladder and it surrounds the urethra, which is the tube that carries urine or your wee out of the body. So the main job of the prostate is to help make semen, which is the fluid that carries sperm. And it's also important to note because there's been some high-profile stories in the news, particularly about the king, around enlarged prostate. So enlarged prostate affects men usually over the age of 50, and it's, as I said, the prostate will get larger as you get older, and sometimes if it's enlarged, it can affect the way you're able to go toilet and how difficult that might be. That's non-cancerous enlarged prostate. The other condition that you could get is something called prostatitis, which is it's an infection or an inflammation of the prostate gland. And again, that's non-cancerous. And it affects men, younger men, usually from the age of 30 to 50 years old. So enlarged prostate and prostatitis are both common occurrences that affect men's prostate, but most importantly, they are non-cancerous, very different to prostate cancer.
Thank you. Okay. And in relation to that, how do you know without having tests whether it's healthy or not?
It's a really, really important question. Your listeners will probably, and I had this conversation actually just recently with a couple of fellas we were working with who had lived experience, or their family members had lived experience of prostate cancer. And I immediately said, you probably think you need to have a digital rectal examination, which is, basically, having a finger in your back passage to find out if there's something wrong or not. Things have changed so much so now that you can have a blood test and it can test, whether or not there is something to be concerned about in terms of your prostate health. So you don't necessarily now have to have, that finger in the back passage, which I know for a lot of men kind of puts them off. So now you can just do a blood test. But early stage prostate cancer, unfortunately, often doesn't have any symptoms at all. So you could have it and not know you have it. And that's why it's so important that we get men, especially men that are at that higher risk of prostate cancer. That's black men, men with a family history of prostate cancer. And for black men, those that are over 45, it's so important that we get them to check their risk. So we've got an online risk check on our website, which is free to use. If you search risk checker prostate cancer, you'll be able to find it. And within 30 seconds, you can find out what level of risk you have, and it will give you advice on what you could do next. And so it might encourage you to go and speak to your GP about your concern. You can say, I did this risk checker and this is what it said about what to do next. And so, having that conversation with your GP is so important, because the earlier you treat it, or the earlier you catch it, the more likely it is to be cured. And so that's why we really encourage people to do an early check. If you're 45 years old, go and you're black, or if you have a family history of prostate cancer, go and use the risk checker. Go and have a conversation with your GP about the option of having a PSA blood test. It really could save your life. Don't wait until you have symptoms in order to do that, because it could be too late if you wait until you have symptoms.
How do you get over the the challenge, the stigma, the keeping cards close to your chest of black men not talking.
Yeah. You know, I don't think it is reserved to black men or for black men. You know, talking in general is a challenge for all men. You know, when we do research into, you know, the barriers that prevent men from speaking about their prostate health or going to speak to their GP, there is no disparity in number of men based on their ethnicity. All men seem to find it challenging to talk about it. But what does really help, we found, is that if they have the tools to be able to themselves kind of take ownership, check for themselves, then it does encourage them to have a conversation. So we've got a service, it's a specialist nurse service. And as part of your induction, you sit into some of their calls, and it really is amazing. First, it's amazing to hear how much knowledge our specialist nurses have around all aspects of prostate health. But then secondly, it's just so encouraging to hear the many different things that men want to talk about. You know, men want to talk about, you know, what does this risk checker mean? You know, I've done it. What does it mean? Men want to talk about, I got this comment back from the doctors. What does this mean? Or if they get their test results, what does this mean? Or if they have been diagnosed with prostate cancer and then they're on that treatment pathway, they want to talk about that as well. Or, you know, like this podcast is focused around, some men are really struggling with their mental health around it, and that's often, that's seldom a subject that is discussed really. You know, we kind of go from you must get checked to you're on the treatment, and then that's almost sometimes feels like it's the end of the story when it really isn't. I've spoken to so many, particularly black men, who are really honest about their experience of being told that they have prostate cancer, irrespective of what stage that is, and the impact that it's had on them mentally. You know, they think about all the various different things that could be, you know, the implications of that. They think about, you know, will they be impotent? They think about, you know, will they be able to, you know, use the toilet without the assistance of a pad, or, you know, so many various different things that men wouldn't talk about naturally. They talk to the specialist nurses about those things. And we also have support groups that are around the country, men that have been diagnosed with prostate cancer, men that are on the treatment pathway, men that have, you know, come on the other side, have been treated, who have set up support groups and just want to encourage more men to come and speak to them about it. Some of those groups have saved lives. I know that they have saved some people's lives, some men's lives who had seriously considered suicide as a result of being told that they have prostate cancer, going through what is sometimes quite a challenging experience of treatment. And so those support groups that we have around the country are so important. And Prostate Cancer UK really does try and support them as much as we can, and an organisation called Tackle as well tries to support them and give them resources that they need.
Okay. It's interesting because in preparation for this, I asked a few of my mates to have a little chat about the prostate, and two of them said, yes, we get checked out regularly. And one said, no, they've never been checked out. But what was surprising was I'd never had that conversation with them beforehand. You know, and it's like the conversations are always in isolation.
Yeah.
Like I said, people keep the cards close to the chest, particularly, you know, black men.
Yeah. Yeah. Well, I mean, before I joined Prostate Cancer UK, I used to be in the barbershop, and, you know, it would be a conversation that you would hear in the barbershop, because it's funny, right? Because until they have the diagnosis, they talk about it in a very flippant way. That was my experience. But once they have once they have someone close to them that has unfortunately died because of prostate cancer, or they themselves have been diagnosed, they become almost evangelists. and they want to tell the world. They want to tell the
Zealots.
world. Yeah, zealots, exactly. They want to tell the world. And in the barbershop that I used to go to in West London, which was intergenerational, you know, we had young guys, old guys going in there, and, you know, topic of debate would be health, because, you know, black people and their health, they, you know, they've got strong association with the health, you know, health message, especially if you're from the church, you know, you've got that health message going on, health and football, obviously. But yeah, when it came to prostate cancer, as I said, you know, there was lots of comments, or you know, in patois as well. You know, I'm not going to do patois because my mom will kill me. But you know, I'm not gonna
I'll go on.
No, not at all. I'm not gonna have a man, you know, do this, you know, put his finger there, and so you have all of these things, and these were, you know, people were hearing this and people laughing about it, and it's a bit of a joke. Until, as I said, someone comes in that has experience being diagnosed, has lost someone, and then they talk really passionately about the need to go and check yourself out. And I was on LinkedIn the other day, and someone posted a video again of someone's a Jamaican guy speaking to another Jamaican guy about going to check out your going to do a PSA blood test, but it was in patois, and it was in the background was this, you know, really common reggae beat, and it was just brilliant because it was just really authentic, really direct, funny as well, very funny, but the message was very, very strong. And I think it's more ways in which we can use those types of messages to get to people, and spaces like the barbershops, like community centres, where, you know, black men congregate and do talk, that we need to use those spaces to get the message across.
Okay. So what I'm hearing is that black men do talk, but the environment needs to be the most appropriate environment for them in order for them to open up, as it were.
Absolutely. Absolutely. Once you get them talking, they don't stop, to be honest. Yeah, they don't stop. So we've got a group, it's called Black Men's Health Advisory Group, who have been instrumental, really, in helping to drive our black health equity agenda. They're effectively, they're a scrutiny group. So we bring, you know, any fresh ideas that we have. At the moment, they're supporting with the development of a black health equity strategy that we're hoping to launch in July. So anything like that, they have been, you know, pivotal in developing for us. And we have our meetings they're 3-hour meetings, but I can tell you they go on for a lot longer than that, because they want to talk. Once they're in the space and they feel comfortable to talk, they want to talk about how can we reach more black men? How can we get the guidelines changed? That's the other thing I must mention. So 1 in 8 men in the UK will get
I wanted to talk more about that.
Yeah. So 1 in 8 men will get prostate cancer in the UK, but that is double for black men. 1 in 4 black men in their lifetime will get prostate cancer. The reasons why, you know, we're still doing a lot of research to try and find out why black men are so much more, you know, at risk of getting this. But nevertheless, that is the situation. So 1 in 4 black men will get prostate cancer in their lifetime. And because that level of risk is so high, it also means that they're twice as likely to die from prostate cancer. The other thing is that for most men, other ethnicities, their age of risk increases from 50, whereas for black men, it increases when they're 45. So it's 5 years younger than most other ethnicities. And also, black men are more likely to develop aggressive prostate cancer. And then a report came out just recently, just to further emphasize the disparity and the need to really think about a targeted screening program for black men and those that have a family history of prostate cancer. Is the National Prostate Cancer Audit released a report in January, which found that black men were being diagnosed at all stages, so including the early stage, which is obviously something to celebrate. But on the flip side, it also meant that they were being diagnosed more at late stages as well, so stage 3 and 4, where it's much more difficult to cure.
Yes.
And then worse still, black men in their 60s were 14% less likely to receive the NICE recommended treatment, so treatment that on the NHS is recommended. Again, why that is, the data doesn't go into the reasons why, but again, it just emphasizes the need for us to really champion the idea of having, or champion the campaign, a move towards having targeted screening program for Black men, because they have a high risk, and for those that have a family history of prostate cancer. So at the moment, we're running. We've been supporting the idea of a targeted campaign. We really welcome the Health Secretary asking the National Screening Committee to relook at the evidence for screening, and in particular, consider the challenge with equity and prostate health. And then the other thing that we're campaigning on, which doesn't require the National Screening Committee to do any more additional work. This is literally changing the wording on the guidelines. At the moment, we're in this really, I think, unforgivable position where GPs are prevented from having proactive conversation with men at the highest risk of prostate cancer, because the guidelines, the NHS guidelines, prevent them from doing that. So you said earlier on, how do you know if you've got prostate cancer? And I was saying, well, unfortunately, early stage prostate cancer often doesn't have any symptoms. So the GPs will only have conversations with men that come and present with symptoms. But again, as I said, that means that you're waiting for men to have possibly late stage prostate cancer, which is harder to cure, before you speak to them about the options of having a PSA blood test. So it's an unforgivable position. I think we've got a moral imperative. Government have got a moral imperative to really get these guidelines changed, which can be done, a stroke of a pen, really. So we're campaigning at the moment. We've got a letter on our website, which is addressed to Wes Street in the Health Secretary, asking, desperately to change these guidelines so that we can save more men's lives, especially Black men's lives, and men that have a family history of prostate cancer.
Can anybody access that letter and say, as a collective, get people to sign it?
Yeah, absolutely. Anyone can go on and sign that letter. Yeah, do it now. We don't want to delay any further. We've got this now. It's irrefutable evidence of the disparity that there is for Black men. So we've got this evidence now. We've got a strong case. The change can be done tomorrow. And so, yeah, please do get on our website, sign the letter, and let's try and get these guidelines changed.
Tim put in the chat about if your mum or sister has a breast cancer, then that's also an indicative risk factor as well.
That's right, yeah. So again, there's research being done in that area, but yes, there is research that gives evidence or provides data that shows if your mum or your sister, if there's a family history of breast cancer, of prostate cancer, then it also increases your risk, your level of risk, absolutely.
Within the Black community, there is issues about trusting the medical profession and overcoming that hurdle. And it feels very much that your role and the role of the Black Health Equity Group and others, it's a bit like Sisyphus, pushing that boulder up a hill and all that.
Yeah.
How do you maintain that momentum?
Yeah, trust is definitely an issue. Trust in terms of, going to speak to somebody, but also trust in terms of being part of trials. So clinical trials, for example, we often get quite low representation of Black men being involved in those clinical trials, which is obviously so critical in trying to find the best treatment for all men, but, in my case, obviously, in particular for Black men. So, for example, there's a clinical trial at the moment that we've invested in partnership with the government, which is a massive trial. It's called Transform.
And we've invested, in partnership with the government, we've invested over £40 million. And it's looking at the most effective way of screening men for prostate cancer. So it's looking at various different existing methods of screening men and trying to find out what's the most effective and efficient way of doing that. So it's a real game changer because of the sheer scale of it. So most clinical trials, they're in the thousands or the 10,000 of participants, whereas this is in the hundreds of thousands. So in phase 1 alone, they are going to be recruiting 300,000 men to take part in that trial. So it really is huge. Phase 1 has started already, and this clinical trial is likely to take 10 years. As I said, phase 1 has started already, and there is expectations that there will be early indications of some of the results of phase 1.
Where's that occurring?
It's taking place nationally, and a significant part of it being a game changer is ensuring that there is a strong representation of black men taking part. So again, they have a target of 10,000 black men plus to take part in this trial. Yeah, so a major part of my role and my colleagues is ensuring that black men are aware of the trial, and when they're invited, that they step forward and take part in that trial. And so when I speak to black men about it, and they respond and say, oh, well, I'm not sure if I should take part, what they're going to do with the samples that they take. I say to them, look, unfortunately, black men are disproportionately impacted by prostate cancer. And so wouldn't you want to be at the front of that queue when they conclude through the trial the most effective way of screening men? Wouldn't you want to be at the front of that queue? We can't be if we don't participate in trials like this. So this is an active piece of community engagement that we're doing.
In addition to that, we're activating as many black men as we can across the country. We've got a really fantastic black community awareness team that get involved with all types of events and activities. We've been at Notting Hill Carnival trying to speak to black men and black families. We're planning to do some other stuff on Black in the Square, I think it's called, Black in the Square. The Mobos was a big moment for us. And then other smaller scale community awareness events, we're really, been pouring and investing in trying to engage black men and black communities through those.
Thank you so much for that, Keith. I think for me, and I'm going to put my hand up here and say, I've never had a PSA test.
Now's the time, Yinka. Now's the time to go and get it.
This is the start of my journey now. This is the start of my journey. And as I mentioned before, a couple of my mates, one in particular, spoke about, I've known loads of people in our community who've died from it, but it's never highlighted, Can I ask, if you're in treatment, you're done, it can come back again like any other cancer, yes?
It can, yeah. I mean, every man is different. So how they respond to treatment is going to be different. What treatment is best for them is going to be different. So it's hard to say, definitively what would happen. And that's, again, that's why I signal our specialist nurses. That's why it's, if you're not sure, if you're concerned, you can speak to our specialist nurses. You can find their details on our website, but I'm happy to give it here as well, if you don't mind.
No, please do. We're going to put out notes with it, but please just mention it now.
If you're struggling with any aspect of, navigating prostate cancer, whether that be, feeling anxious about doing a PSA blood test or speaking to your GP, or you've done that, you're waiting for the results, or you've got the results and now you're either doing active surveillance, so that's, doing regular checks, or you're actually, moving on to the treatment, you can speak to any of our specialist nurses if you call 0800 074 8383, and you can speak to them, and they'll be happy to speak to you and help you.
And they're open 9 to 5 Monday to Friday, and Wednesdays 10 till 5 p.m.
Exactly, yeah. So Monday to Friday is 9 till 5, and then Wednesdays 10 till 5.
Thank you so much for that. Going back to GPs, you mentioned, I think sometimes, again, part and parcel of a little bit of research for this, some people's experiences have been that reluctance of GPs to step up for the patient when they come in, when they've got concerns, etc. How do we overcome that? Can we be insistent on that?
So the chair of our Black Men's Health Advisory Group, when I first met him, he said something that stuck with me. And it was, if you're not happy with the conversation that you've had with your GP, or, you know, what they've given you in terms of next steps or advice, if you're not happy with the outcome of that conversation, you're not wedded to them. You don't have to stay there. You can speak to another GP. You can get a second opinion.
Absolutely.
So the first thing to say is, don't feel just because they've got doctor in front of their name that you can't go somewhere else for a second opinion. Please do it. This is about your own health. And the second thing is to say is, you know, it is your health. So you do have to be the CEO of your own health. You do have to, you know, do what's right for you. Don't rely on somebody else. And then the third thing is to say is, we know of GP practices that have done amazing campaigns to proactively reach Black men. So there is I'll shout out the Southeast Council Alliance, who have worked with GP practices across Southeast London, and they've done a texting service where they've looked at the database of that they have, and they've picked out Black men over a certain age, over 45 years old. They've sent them an official text to say, come in and speak to me about a PSA blood test. And they've had really great results, both in terms of men turning up, Black men turning up to do it, and then also being diagnosed. So obviously you don't want to celebrate, you know, a diagnosis of prostate cancer. That's not what you want, but it's good that if you do get them to come, it is good that you spot it. And a lot of them is at early stage as well. So that's even more encouraging. So and I've heard of examples of similar sorts of projects and programs in the West Midlands. GP practices have worked with alliances and community organisations to really understand what are the challenges, what are the barriers to getting Black men to come and speak to their GP, been focusing on trying to address those barriers and those challenges, thinking about language that they use, thinking about the materials, thinking about being in the spaces where Black men are rather than having to wait for them to come to you.
Yes.
So there are fantastic examples of that happening across the country, but it's not going to be consistent because of those guidelines. Until we get those guidelines changed, GPs are in effect beholden to follow those guidelines. You know, in effect, they are being told, don't do it unless a man presents with symptoms. But I strongly believe, and I know this is not shared with everybody, that especially, you know, Black men that have had really terrible experiences of being turned away from their GP practice, and then 2 months later going back and then being diagnosed at late stage. So I've heard some harrowing stories of that happening. However, I do believe that the majority of GPs have their patients' health and well-being at their heart, you know, that they want to do the best by their patients. But those guidelines are hampering them from being able to do that. And so that's why we're campaigning to get them changed.
Good. And just to underline all of that, people listening there may experience issues with urinating, feeling that their bladder hasn't fully emptied, need to urinate some more than usual, usually at night. So if they experience this, get checked out.
Get checked out. Yeah, absolutely. 100%.
The mental health, you alluded to the mental health side and the impact there. You know, is there any, I suppose that's in part, that's what the specialist nurses are there for as well, you know, to not necessarily placate, but understand, empathize with the fears that people have.
I mean, many men with, both before they get the results back and if they've been diagnosed, you know, the kind of stages that they might go through is like shock or fear or anger. Then it might materialize into denial. Then it might materialize into frustration, disappointment, and stress. And then if they are, you know, faced with the prospect of either going to do an MRI scan, then it might be the anxiety or the worries about, you know, if the MRI scan does, you know, bring up an issue that they need to do a biopsy and find out more about. Then there's worries about what are the side effects if I do decide to have treatment? You know, what are the side effects? I talked about, you know, erectile dysfunction, you know, problems with going to the toilet, urinary and bowel problems. So there's all of that wrapped into it. Also, you know, treatment it can mean that you are off work for long periods of time. Again, if you can't afford to do that, that's an additional worry for you. Then there's the mood swings that you might have when you're on things like hormone therapy, the anxiety that you will still have. And then lastly, I suppose that feeling of you're doing it on your own.
Yes.
And that's why the support groups are so important, I think, to providing you with that confidence that you're not on your own, because you're speaking with men that have probably been through the experiences that you have been through, and want to talk to you about those experiences. So that's why those support groups are really important. On our website, we've got a guide, and then specifically about anxiety, like how to deal with anxiety. So we've got a guide which is very tries to speak in language that men recognize, to tackle that journey of emotions that I just described that men might face. So you can go on there. But yeah, as I said, the support groups are really powerful groups for you to, if you're worried or you're going through those emotions, to access.
Keith Morgan, Associate Director of Black Health Equity for Prostate Cancer UK. Thank you.
It's a pleasure.
I have one more question for you, though. Who's the most important person in your life?
Oh, well, you know what? What's funny is that both my mum and my wife are downstairs. I probably could hear this. So,
you can only pick one.
You put me. Listen, I spend more time with my wife, so I'm going to say my wife is the most important person in my life. She's a pillar to me.
Okay. Yeah. And I'm going to say you're wrong. I'm going to say the most important person in your life is you.
Yourself. I knew you were going to say yourself. But as I said, I've got them downstairs. So if I say me, I'll be in trouble. But you're quite right, Yinka. It is yourself, of course.
Keith Morgan, thank you for appearing on The Hurt Locker.
Absolute pleasure. Thank you for having me.
The Hurt Locker is a safe space for our guests to openly share their mental health experiences. If you have been affected by any of the content in this recording, then please reach out for support. If it is an emergency, dial 999. If you would like to talk to somebody today, then please call the Samaritans on 116 123. Stay safe. Thanks for listening to this episode of The Hurt Locker. Please give us a rating or share with another listener. You can also follow us on Instagram and Facebook at The Hurt Locker Pod.